Let's talk about heartworm disease in cats. Despite being more commonly associated with dogs, cats are not immune to this potentially deadly condition, and there are some important differences to note. Heartworm disease is caused by a parasitic worm known as Dirofilaria immitis, commonly referred to as heartworms. While these worms primarily infect dogs, they can also affect cats, although less frequently, with an infection rate of about 5% compared to dogs. Recent studies of cats with heart and respiratory diseases have revealed a higher incidence of heartworms than previously believed. Cats are atypical hosts for heartworms, which naturally makes them more resistant to developing the disease, resulting in a longer life cycle for the worms compared to dogs. The disease is transmitted through the bite of infected mosquitoes, which carry the immature larva of the heartworm. Once infected, the microfilariae migrate through the bloodstream to the heart and lungs of the cat, where they develop into adult worms. Unlike in dogs, heartworms in cats often fail to mature into adults, but even a single worm can cause severe health issues. Very often a cat will only carry 1 to 3 worms, and if they happen to all be of the same sex, they will not produce microfilariae. In a cat, the worm can grow up to 30 centimeters long and reach a lifespan of 2-3 years. For that reason, some clinicians opt for no treatment if the cat is asymptomatic and simply wait out the lifespan of the worms. After migrating into the bloodstream, heartworms tend to settle in the pulmonary artery and right ventricle, which later leads to right ventricular hypertrophy. Acute infection of heartworms in cats can manifest with a variety of symptoms, often indicating severe health complications. These symptoms may include salivation, which could be a result of respiratory distress or other complications. Tachycardia can occur as the heart works harder to pump blood through vessels obstructed by heartworms. Severe infection may lead to shock, characterized by low blood pressure, weak pulse, rapid breathing, and pale mucous membranes. Coughing up blood, or hemoptysis, can occur due to damage to the lungs caused by migrating heartworms or inflammation in the pulmonary arteries. Acute heartworm infection can sometimes lead to neurological symptoms such as seizures, paralysis, or disorientation, though these are less common compared to respiratory and cardiovascular manifestations. In some cases, cats may succumb to acute heartworm infection due to sudden blockages caused by worm emboli or migration of worms to critical organs, leading to organ failure or cardiac arrest. Cats in the chronic phase of heartworm infection can develop heartworm-associated respiratory disease, which is similar to asthma. The symptoms include coughing, wheezing, and difficulty breathing due to inflammation and constriction of the airways. Vomiting may occur in cats with heartworm disease, often as a result of irritation to the gastrointestinal tract caused by migrating worms or as a secondary effect of respiratory distress. Cats may lose their appetite or exhibit decreased interest in food, leading to anorexia. This can be a consequence of general malaise, discomfort, or secondary complications associated with the infection. Chronic heartworm infection can lead to weight loss due to a combination of reduced appetite, increased metabolic demands from the immune response, and the strain on the cat's cardiovascular system. These symptoms can vary in severity depending on factors such as the number of worms present, the duration of infection, and the cat's overall health condition. Diagnostic methods for heartworm disease in cats involve a combination of tests to detect the presence of the parasite or its effects on the cat's body. Heartworm antigen tests, like for example the feline triple SNP, detects the presence of heartworm antigens in the cat's bloodstream. A positive result is typically diagnostic of heartworm infection, indicating the presence of adult female heartworms. However, a negative antigen test does not necessarily rule out heartworm disease, as it may produce false negatives in cases of low worm burden or all-male infections. Unlike the antigen test, the antibody test detects antibodies produced by the cat's immune system in response to heartworm exposure. A positive result indicates previous exposure to heartworms, but does not necessarily confirm an active infection. Therefore, this test is more indicative of exposure rather than current infection status. X-rays of the cat's chest area can reveal abnormalities such as enlarged pulmonary arteries, changes in lung texture, or even the presence of heartworms themselves. On echocardiogram, heartworms can appear as double-lined echo densities, indicating their presence within the heart or pulmonary arteries. This can help in confirming the diagnosis and assessing the severity of heartworm disease. Other diseases such as asthma, feline infectious peritonitis, heart disease, parasitic pneumonia, and other respiratory diseases can have similar symptoms to heartworm disease, so they should be also considered. Treating heartworm disease in cats is complex and carries inherent risks due to the delicate nature of the feline cardiovascular system. There is no approved treatment specifically for cats, and management often focuses on supportive care to alleviate symptoms and prevent complications. In some cases, surgical removal of adult worms may be attempted, but it's a challenging procedure with potential risks. Unlike in dogs, melarsoline is not commonly used in cats due to its potential toxicity. Doxycycline is often administered to cats with heartworm disease to target bacteria called Wolbachia, which live symbiotically with heartworms. Eliminating Wolbachia weakens the heartworms and makes them more susceptible to other treatments. Bronchodilators may be prescribed to alleviate respiratory symptoms such as coughing and wheezing. These medications help relax the muscles around the airways, making it easier for the cat to breathe. Corticosteroids such as dexamethasone or prednisolone may be used to reduce inflammation in the airways and lungs, thereby alleviating respiratory distress associated with heartworm disease. Prevention is crucial in managing heartworm disease in cats. Monthly preventatives containing medications such as ivermectin, selamectin, or melbamycin are commonly used to prevent heartworm infection and control other parasites. These preventatives are typically administered topically or orally, depending on the product. The prognosis is similar to other cardiovascular diseases, with median survival time of approximately 5 years. An interesting fact that is specific for cats only is that the larvae are likely to migrate to ectopic locations such as the brain, skin, and lungs.